morning. Happy Monday. Today we're going to be talking about heart disease and heart attacks, and I'd like to go over a little bit of the notes with you guys. So heart disease is our number one leading cause of death in the U.S., and these stats are probably from last year or the year before. So heart disease ranks number 1, cancer 2, accidents, especially car accidents, is number 3, so make sure you wear your seatbelt. Chronic lower respiratory disease is 4, stroke 5, Alzheimer's disease 6, and diabetes 7. So in your notes from last week on page 6, there was a section on heart attacks. So I'd like you to gather some supplies right now. Go ahead and pause the video. You need something to write with. Red, yellow, and brown. Okay, so back to page 6 of the notes. So last week you were supposed to label this diagram. This shows the heart muscle, coronary arteries. Coronary arteries are the arteries that feed the heart muscle. The heart cannot use the blood that's inside of it because the walls are too thick. So it has to have its own network of blood vessels that keep this muscle working, and they're called the coronary arteries. Now, every artery in your body doesn't have a name, only the major ones. So like the aorta is technically an artery. Remember from last week that all arteries go away from the heart. Okay, so moving on. I kind of shaded in a little bit of the heart muscle, as you can see. And here is a coronary artery, which they then take over here and blow up to make it look bigger. So you can see that it's feeding, it's bringing oxygenated blood to feed the heart muscle. Well, over here we have some plaque buildup, and this relates closely to diet and exercise, even some genetic factors. So go ahead and use your yellow to represent the plaque buildup. So it's making it harder for blood to get through. Now this is especially a problem if there's a blood clot. So you can see the little red blood cells here, and they have clotted together with the platelets. And so now there is complete blockage here so that blood cannot flow. So go ahead and grab your brown, and then down here we're going to have some dead heart muscle. Okay, so what can we do about it? There are some things that can be done. Some of the treatments, these are not the only treatments, but some of the treatments out there would be having surgery, putting in things like a stent. So here's an example of putting in a stent. It looks like kind of like chicken wire. There's a couple different ones out there in the market. And what that does is it pushes the plaque out of the way and widens the artery. So here's the plaque so that blood can flow through. They can also try to clean out the artery with like a rotational burr is what it's called. They can also do a balloon angioplasty. Some people will be a good candidate for a surgery where they will have a bypass. And what they do is they often take a blood vessel from the person's leg, and here's the aorta, and they attach a new vessel. So as oxygenated blood leaves the heart, it's going to come right back around and bypass the problem. So maybe they would connect it down here below where the problem is. So they, you've maybe heard of like a double, triple, and quadruple bypass. And these are just how many arteries they hook up to the aorta or one of the branches of the aorta and bring oxygenated blood back around to feed the heart. So I think it's also important to talk about prevention, since it is one of our number 1 killers. So the American Heart Association has a pretty good website, and I liked this little graphic that they have that kind of shows what you can do to prevent heart disease. So one thing is to keep your blood pressure in check, as represented by this picture. Okay, so you want to be under 120/80. That's just our general, when they're checking your blood pressure, what they're kind of looking for you to be under. Keep your cholesterol, your HDL cholesterol high and your LDLs low. And that has to do with your diet and exercise. Keep your blood sugar at a good amount, especially if you're a diabetic. Make sure that you're eating healthy, balance in your diet. I'm not saying you can never eat Doritos, but just make sure you're having all of your healthy food plate each day. Keep your weight at a healthy weight. Exercise, and if you're a smoker, stop smoking. Okay, so I hope you have a better understanding of why we need to eat good, exercise, and keep balance in our day, because we definitely don't want to have to deal with heart disease. All right. Let me know if you need anything. I'm available all day long.